A 21-year-old female presented with complaints of headache from the last 1 month, and she was using over-the-counter analgesics for pain relief. No much improvement. She's not on any OCPs, so CVT is ruled out, and her menses are regular. On examination, BMI is 37. Okay, at this point, I would still consider like pseudotumor cerebri, idiopathic intracranial hypertension as one of my differentials, and acanthosis nigricans is not present. Acanthosis nigricans is not present. Her blood pressure is 210 by 140, and there is no difference in blood pressure in all her limbs. No difference in blood pressure in all her limbs. Ultrasound shows no shrunken kidneys. Urine metanephrines are also not there. CT angio is performed and it is shown below. There is some um, on angiogram, what we find is like a beaded appearance of the blood vessels, bleeded appearance of blood vessels. So for whatever whoever is wondering, this is a CT angio of kidneys, CT angio of the renal arteries, renal artery. Okay, so there is a beaded appearance of renal artery. Can you make out the kidney here? Yes, renal artery. So beaded appearance of renal arteries is present whenever you see a 21-year-old with so much of hypertension wherein the blood pressure, please rule out all the secondary causes of hypertension. Secondary causes of hypertension. So taking into consideration a young female, 21-year-old, one could be like congenital renal artery stenosis the patient can present, the causes of which would be different because atherosclerosis to cause renal artery stenosis. Atherosclerosis to cause renal artery stenosis. Usually, it happens in elderly individuals. Elderly individuals and males more common than the females. Males more common than the females, and also in smokers and other risk factors for atherosclerosis like diabetes. If all these are considered, think the cause of renal artery stenosis could be atherosclerosis. Other causes of renal artery stenosis will be congenital, can be fibromuscular dysplasia. Fibromuscular dysplasia. Okay, so fibromuscular dysplasia is characterized by renal artery and intracranial and extracranial arteries. Intracranial and extracranial can be involved. Extracranial arteries can be involved of neck. Okay, head and neck vessels and renal arteries can be involved. They can cause like this beaded appearance of aneurysms and stenosis. Aneurysm, stenosis, aneurysm, stenosis. This can be present. So even in the brain, they can have intracranial aneurysms. Here, her blood pressure, her headache could have been due to high blood pressure. But otherwise, you, if it is like a very bad headache suddenly happening, you should also think there could be a aneurysmal rupture. There could be an aneurysmal rupture. Aneurysmal rupture. Okay, so we have to keep that also in mind because intracranial aneurysms can also happen, renal artery can also happen. Secondary hypertension, they will develop uncontrolled and difficult to treat hypertension. The treatment will only be the treatment of the fibromuscular dysplasia will only be renal artery stenting. Renal artery stenting. Okay, so you'll have to rule out what are the causes of renal artery stenosis, which will be either atherosclerosis or fibromuscular dysplasias. Okay, so which among the following conditions could be the cause of hypertension? Primary hypertension? No. Very young female without any family history, no other causes, signs of metabolic syndrome, like no acanthosis. Only fact is she's obese. Otherwise, there are no other features suggestive of metabolic syndrome. So that can be ruled out. Takayasu arteritis can also be ruled out. Takayasu arteritis is usually a large vessel vasculitis. Is usually a large vessel vasculitis. It involves the aorta and its proximal branches. Aorta and its proximal branches, and these proximal branches usually can be subclavian artery or something. So patient will have a deficit in the pulses. One hand will be pulseless, extremities will be present. Here they told that blood pressure is equal in all the four limbs, so that is also ruled out. And other conditions like coarctation of aorta, which will cause differential hypertensions, also can be ruled out. Fibromuscular dysplasia, yes, taking into consideration fibromuscular dysplasia is more common in young females, is more common in young females. and characterized by secondary hypertension. Okay, so this is the likely answer. Polyarteritis nodosa, yes, polyarteritis nodosa involves the renal vessels. I agree. Correct. It also causes beaded appearance. It also causes string and beaded appearance. Correct, because of microaneurysm formation. Here also because of microaneurysm formation. But here there will be a transmural fibrinoid necrosis will be there, and that will lead to like a aneurysmal dilation, and again transmural inflammation causing like stenosis. So this will also cause string and beaded appearance. Correct. But other involvement is usually common in males, polyarteritis nodosa, and middle-aged people association. Somehow you'll get a clue that patient is HbA positive in the questions. And the second thing is, apart from only renal involvement, the patient will have other splanchnic vessels involvement. Other splanchnic vessels involvement most commonly, like they'll have abdominal pain or some intra-abdominal bleed or something like that, because celiac and all will be involved. Here nothing is there. Here usually renal vessels and intracranial and extracranial vessels of the head and neck are involved. So this also can be based on just on CT angiography. You might not identify if it's polyarteritis nodosa or fibromuscular dysplasia. You will have to take into other clues of being a female, young, this thing, and involvement of headache. Some intracranial symptoms should be also considered here. Okay, so that is why you have to rule out, and would be the most common cause would be the fibromuscular dysplasia. Thank you.